Hello, everyone, and thank you for joining our Back to Basics Nutrition Services under Title III webinar. I'm joined today by Louise Ryan, your ACL Region 10 Regional Administrator, who covers the states of Alaska, Idaho, Washington, and Oregon. I'm also joined by Carrie Lipperini, who's the Director of the Office of Nutrition and Health Promotion Programs in the Administration on Aging. And also from our Office of Nutrition and Health Promotion Programs is Patty Keene, our National Nutritionist. From all of us, we thank you for joining. As people continue to join our webinar today, I'd like to go over a few housekeeping items. This webinar is being recorded, and the slides as well as the recordings will be posted on acl.gov/OAA rule in the coming weeks. The chat feature is disabled. However, the Q&A feature is available for people to leave questions, and we will do our best to respond to your questions live or take them back for further consideration. Additionally, CART and ASL services are available. Along the bottom of your Zoom screen, select Captions for CART and select Interpretations for ASL. And I believe there's also a link for captions in the chat.
Yes, and you don't have to select interpretation because we have the ASL interpreters pinned.
Great. Thank you, Marcia. And I'm Alice Kelsey, Deputy Director for the Administration on Aging, and it's wonderful to see so many of you on the call and to welcome you to our 5th webinar in the Back to Basics webinar series as part of ACL's rollout of the updated 2024 Older Americans Act regulations, also known as the Act or the OAA regulations. We have been hearing from many of you, some of you at summer conferences and in-person meetings, and we've heard that the network is eager to hear about the details regarding the new OAA rule, and today's webinar will cover many details related to nutrition services. Please note that while today's webinar has a nutrition focus, other Back to Basics webinars have nutrition topics incorporated as well. We recommend you go back and watch the other webinar recordings posted on our webpage at acl.gov/OAA rule. For today's presentation, we'll follow the agenda on this slide. We'll start by discussing the Older Americans Act final rule provisions, and then we'll dive deep into those that are applicable to the Title III programs regarding nutrition. And we'll conclude with a summary and review of available as well as planned resources. As we reviewed in our prior Back to Basics webinars, what we mean by Back to Basics is how do we effectively meet the mission and the vision of the Older Americans Act through a holistic program management strategy or approach. Our view is that this is a holistic approach that includes program, financial, data, evaluation, training, communications, and policies and procedures that you should have in place. And it's important that all of this is in alignment to create the holistic program management strategy. By doing so, we maintain the integrity of our advocacy activities, as well as provide targeted, effective, and efficient activities throughout the aging network at the state and the local levels. In terms of why we're talking about this now, and we mentioned this in prior webinars as well, we're doing this Back to Basics series because we felt it's perfect timing to have it coincide with the first comprehensive update to the Older Americans Act program regulations since 1988. That's 36 years. It's also that we learned so much from the COVID-19 pandemic, and we wanted to incorporate those components in future programming, ensuring that the flexibilities are there, but the right amount of stewardship and oversight is also there. We also have heard about a large number of retirements from people with incredible levels of institutional knowledge from our programs. For example, maybe your key budget person left or your key program person left. We want to restore the knowledge of program administration expectations and give you the foundational components. We are very aware of and excited by the fact there are new and developing business opportunities, as we have been focused on contracts and commercial relationships, previously referred to as business acumen. Having the network develop these skills in order to expand services and supports to more older adults and family caregivers and truly partner with the healthcare sector and develop relationships with them is critical. We want to ensure that you have all of the basic components in place to operate in an effective and efficient way that will withstand anyone reviewing and asking about the aging network programming. And last, we see somewhat of an increased interest in the overall stewardship of public funds, and it's coming from all sectors. We are hearing inquiries from Congress, we're hearing inquiries from state auditors, and from all quarters about this effective stewardship of public funds. And so we want the Aging Services Network to continue to be effective in responding to these. Most importantly, we want you to be truly effective stewards of public funds. And now I'm pleased to turn the presentation over to my colleague, Louise Ryan, who is the ACL Regional Administrator in Region 10 to discuss the OAA final rule provisions.
Thank you, Alice, for that introduction and for providing background information. Again, my name is Louise Ryan. I'm the Region 10 Regional Administrator. Next, we'll review general information on the Older Americans Act final rule, and then go into detail on key provisions related to nutrition services. The effective date of the OAA final rule is 30 days after publication in the Federal Register, which was March 15th. However, ACL is providing an implementation timeframe until October 1st, 2025. We are providing robust technical assistance in coordination with ACL-funded resource centers and other partners to implement the final rule. There will also be a collaborative corrective action plan process for states that experience challenges in meeting this timeframe for certain provisions under the final rule. The state units on aging, or SUAs, and ACL will jointly identify progress milestones and a feasible timeline for addressing the areas at issue. And we envision that we will include all items with each SUA in a single corrective action plan for ease of communication and tracking. Each item will have its own unique milestones and overall timeline. We anticipate a form and instructions to be available soon, and that we will review at an upcoming state plan guidance webinar, which is tentatively planned for next month. And more information will be provided at that time. The final rule covers titles 3, 6, and 7, so it is a lengthy document. As published in the Federal Register, it is 134 pages, and it's important to know how to navigate the final rule. So at a high level, the final rule can be broken into two parts. The first portion is the preamble. The preamble provides background information, explains the regulatory text, describes comments received and our responses, and gives information on required regulatory analysis. It's about 2/3 of the total document. This portion can help you understand how to implement the regulatory text. The second portion is the final regulatory text in full for Title III. So that's Code of Federal Regulations 1321. For Title VI, Code of Federal Regulations, or CFR 1322, and Title VII, CFR 1324. The regulatory text contains the actual requirements. So when you see the citations, for example, 1321.87 or 45 CFR 1321.87, this is what we are citing. Additionally, when reading the regulatory text, you will see words such as shall and may. To be clear, shall indicates a requirement, and may indicates that something is optional. And on March 15th, the regulation was published in the Code of Federal Regulations, and can now be found at www.ecfr.gov as well. For more detailed orientation to the final rule, I strongly encourage you to visit ACL's regulation webpage, acl.gov/OAA rule, where we have posted webinars and other resources. This webinar is also where we will post this presentation, as well as a recording of this presentation as it becomes available. It's important to remember that the vast majority of what is included in the final rule are long-established Older Americans Act requirements, reaffirming what is in statute, prior regulations, or existing policies, rather than new requirements. Many grantees already have most of these requirements in place. We're not going to cover every single word of the final rule related to nutrition services in this webinar. We encourage you to go to the officially published rule for the specific requirements that apply. However, we hope that this webinar will help you identify those areas of the final rule to read and reference. To start, it's important to highlight that Section 1321.3 contains definitions of many terms used in the rule. Some of the ones that nutrition staff may be interested in are listed on this slide. We encourage you to go to the definitions section in the regulatory text to review the specifics. We would also like to affirm that if you have a state and/or local definition, it must align with the regulation. It might have more detail, but it can't conflict with what is in the act or rule. And another potential tip, if you don't already have a definition, now is a great time to visit the regulations first. You may be thinking about the processes you will go through to update your policies and procedures. The rule contains requirements that can help you to make such changes. First, state unit policies and procedures must be developed in consultation with area agencies on aging, program participants, and other appropriate parties in the state. These policies and procedures are to address program, fiscal, and data collection and reporting requirements. Area agencies on aging are required to develop policies and procedures in compliance with state unit policies and procedures, including those under Section 1321.9, in consultation with other appropriate parties in the planning and service area. Additionally, Section 1321.73 sets forth requirements to ensure that AAAs and local service providers develop and implement policies and procedures to meet minimum requirements set by state unit policies and procedures in accordance with Section 1321.9. The provision also specifies that state units and AAAs must develop monitoring processes, the results of which are strongly encouraged to be made available to the public. The rule specifies that the state unit will have policies and procedures regarding fiscal requirements, including nutrition services. This slide gives examples of some of the fiscal requirements that apply to nutrition services, such as non-federal share or match requirements, transfers of funds between Titles B and Titles 3C, and between Titles 3C1 and 3C2, voluntary contributions, use of program income, private pay programs, contracts and commercial relationships, and buildings, alterations or renovations, maintenance and equipment. For example, under the non-federal share Match proceeds from fundraising activities may be used to meet match requirements when no federal funds were used in conducting the fundraising activities. Program income must be used to expand a service funded under the Title III grant award for which the income was originally collected. Voluntary contributions and cost-sharing contributions are considered program income. State units must establish policies and procedures related to contracts and commercial relationships. For building alterations or renovations, maintenance and equipment, prior approval of purchase is no longer required, and a notice of federal interest must be filed at the time of acquisition of a property or prior construction where allowable. If you have questions or would like more information on fiscal requirements, such as regarding transfers, we encourage you to visit the acl.gov OAA rule website and review the previous recorded webinar on fiscal policies and procedures. On the website, you will also find the fiscal fact sheet. And please note that we will have a webinar on contracts and commercial relationships at a later date. Title III and Title VI coordination responsibilities. Title III and Title VI coordination is required under the Act, and all entities are responsible for coordination, including state units, AAAs, service providers, and Title VI grantees. For example, state plans must explain how a state aging network, including AAAs and service providers, will coordinate with Title VI programs, including in emergencies and disasters. Regarding Title III, Title VI coordination under Part 1321, see the provisions listed on the slide. The provisions specify what must be minimally addressed by policies and procedures. For example, Section 1321.95 specifies in locations where there are Title VI programs to serve American Indian, Alaska Native, and Native Hawaiian elders and family caregivers, AAAs and/or service providers must have policies and procedures developed in coordination with relevant Title VI program directors to explain how the service provider will coordinate with Title VI programs. The policies and procedures must, at a minimum, address how the service provider will provide outreach to tribal elders and family caregivers regarding services for which they may be eligible under Title III, and among others listed in the provision. For more information, please refer to acl.gov/OAA rule for webinar slides, recordings, and fact sheets on Title III, Title VI coordination. Serving populations of greatest economic need and greatest social need. Because OAA funds are limited and not intended to meet all needs of all older adults and family caregivers, it is important that we ensure that we are targeting services to populations that are in greatest economic and greatest social need. In the preamble section 1321.27, we explain that states and AAAs must use these definitions in their planning activities to consider how they identify and assess these populations, how they target the populations for service provision. They may then establish priorities given limited availability of funds and other resources. They must then establish methods for serving the prioritized populations. For example, might distribute under the interstate funding formula, but not required or exclusive, might partner with certain organizations or develop referral protocols or conduct trainings on serving a certain population. Finally, they must use data to evaluate whether and how the prioritized populations are being served. They might use SPR, state program reporting data, but that's not required or exclusive. Or in some cases, data system is not set up to gather data in that way, but perhaps you can gather data through client satisfaction surveys, focus groups, or other indicators like new partnerships developed. Both quantitative and qualitative data is important. Section 1321.27J is the content of the state plan. It specifies what the state plan shall include if the state unit allows for a portion of Title III Part C1 funds to be used for shelf-stable pickup, carry-out, drive-through, or similar meals as set forth in Section 1321.87A1I. We will discuss this in additional detail in an upcoming slide. Note that state plans must provide evidence that they are informed by and based on area plans in states with multiple planning and service areas. State and area plans should be informed by and reflect one another. Regarding public participation, the state unit is required to establish and comply with a reasonable minimum time period of at least 30 days for public review and comment on new state plans and state plan amendments requiring approval by the Assistant Secretary on Aging. Section 1321.49, intrastate funding formula, requires an intrastate funding formula for the allocation of nutrition services funds specific to each planning and service area to the AAAs, and a statement of how NSIP funds will be distributed. Section 1321.51, single planning and service area states, requires a funds distribution plan which describes how the state unit determines the geographical distribution of nutrition services and NSIP funds. For more information regarding state plans and intrastate funding formulas, please refer to acl.gov/OAA rule. You can find a recording of our past webinar on state and area plans and intrastate funding formulas. Later in the webinar, we will have an example of how nutrition services fits into the state plan. Area agencies on aging and area plans. Section 1321.63, Area Agency Advisory Council, requires each AAA to establish an advisory council with membership including representatives of service providers, which may include nutrition service providers. Section 1321.65, submission of an area plan and plan amendments to the state unit for approval, includes clarifications regarding assessment and evaluation of unmet need, as well as planned services to be provided, including numbers of individuals to be served, type and number of units, and corresponding expenditures. It also specifies what the area plan shall include if the AAA requests a portion of Title III Part C1 funds to be used for shelf-stable pickup, carry-out, drive-through, or similar meals as set forth in Section 1321.A7A1I. And this is also known as grab-and-go meals. Also, that the area plan reflects statutory updates with respect to inclusion of hunger, food insecurity, and malnutrition and other conditions. Again, you will see a nutrition services example as it relates to the area plan later in this webinar. Emergencies and disasters. As Title III Part C nutrition services may be impacted by emergencies and disasters, we include a discussion of two provisions from Part 1321, Subpart E, Emergency and Disaster Requirements. Disaster relief services may include any allowable services under the Act to eligible older individuals or family caregivers during the period covered by the Major Disaster Declaration. Section 1321.99, setting aside funds to address disasters. This clarifies that if state units may specify that they are setting aside Title III funds, up to 5% of their total Title III allocation for disaster relief in their interstate funding formula or funds distribution plan, and provides direction as to the process a state unit must follow in order to award such funds for use within all or part of a planning service area covered by a specific major disaster declaration where Title III services are impacted, as well as requirements with respect to the awarding of such funds. Please note that set-aside funds awarded under this provision must comply with the requirements in Section 1321.101. 1321.101B outlines flexibilities a state unit may exercise under a major disaster declaration. Flexibilities to meet the needs of older adults, such as those related to meal delivery systems, methods for conducting well-being checks, delivery of pharmacy, grocery, and other supplies, and other vital services. State units must have policies and procedures outlining communication with area agencies on aging and/or local service providers regarding state unit expectations for eligibility, use, and reporting of services and funds provided under these flexibilities, and include the ombudsman as set forth in Part 1324, Subpart A, if funding for the ombudsman program is affected. A state unit must submit a state plan amendment as set forth in Section 1321.31B if the state unit exercises any of these flexibilities. The state plan amendment must, at a minimum, include the specific entities receiving funds, the amount, source, and intended use for funds, and other such justification of the use of funds. Note that we will also have a Back to Basics webinar on emergency and disaster requirements at a later date. Now let's turn the presentation over to Carrie Lipperini, the Director of the Office of Nutrition and Health Promotion Programs, to dig a little deeper into the nutrition services portion of the Older Americans Act final rule.
Thank you, Louise, and just very happy to be here and excited to talk to you about a high-level overview of the Senior Nutrition Program and as it relates to the final rule. So the Senior Nutrition Program is one of the flagship social programs in our country's history. Since 1972, the program has funded local agencies and organizations that have helped to ensure older adults have opportunities to stay healthy, independent, and connect where they live, with their lives, and how they want to live in their communities. The core intents have remained the same for 52 years: to reduce food insecurity, hunger, and malnutrition, to enhance socialization, and to promote the health and well-being of older adults. Nutritious meals are vital to their older adults' lives, and they're the cornerstone of our program. However, it's not just about food, because a meal is so much more when it leads to social connection. So the idea of combating social isolation through congregate meals was not just a good idea. It was basically, the studies have shown that people who engage in the Senior Nutrition Program are healthier and happier. And our program runs much deeper, providing nutrition screening, nutrition education, counseling, and an array of home and community-based programs that support older adults and overall health and well-being. We know that the Senior Nutrition Program supports older adults' overall well-being. For example, in our 2023 nutrition survey of the older adult programs, we noted that 75% of congregate participants and 91% of home delivered participants noted that the program helped them live independently. We also noted that 76% of congregate participants and 81% of home delivered meal participants noted eating healthier because of the meal program. 72% of participants and congregate meal programs 76% of congregate meal programs and 81% of home delivered meal programs noted that they're eating healthier because of the meal program. 72% of participants in congregate meal programs noted that their health improved as a result of this program. Earlier, Louise noted that program policies and procedures that the SUA and AAAs and service providers must have. Eligibility is another example of policies and procedures that must be included. Section 1321.81 is the rules addressing eligibility for Older American Act services. The OAA statute sets eligibility for OAA services as a recipient must be at least 60 years of older at the time of service, except in the cases of limited circumstances for specific services as specified in the Act. For nutrition services, services shall be available to spouses of any age of older persons. So that means that if James is 62 and participates in the nutrition program, either congregate or home delivered, his husband Marcus shall be eligible no matter what his age. Services may be available to persons with a disability who live with an age-eligible person who resides in nutrition services. So if Maria is an 80-year-old who lives with her daughter, Sylvia, who is intellectually disabled, Sylvia could be eligible for the program, can be eligible if the program wishes to allow that, no matter what Sylvia's age is. Another exception is if there is a housing facility, particularly occupied by older adults. That includes the funded congregate meal programs. A person with a disability may attend that program if they are under the age of 60, again, if that program wishes to allow that. Finally, a volunteer during a meal hour may be an eligible participant. As noted, this may be an opportunity to engage family caregivers who want to attend with and assist their family member, people with disabilities who are not living with an age-eligible older adult, and or something to highlight in recruiting volunteers to the nutrition program if the program wishes to allow that. State Union on Aging's AAAs and service providers may develop further eligibility requirements as long as they don't conflict with the Act or guidance set forth by the Assistant Secretary for Aging, and that may include assessing of the greatest social need, assessment of the greatest economic need, assessment of functional and support needs, geographical boundaries, limitations on the number of persons that may be served, limitations on the number of units served that may be provided, limitations due to the availability of staff and volunteers, limitations to avoid duplication of services, and specifications of settings where services shall or may be provided. Please note that there are exceptions for other services, such as the family caregiver support services. There will be a webinar which includes coverage as it relates to Title III services later at a later date. We encourage you to consider that there might be ways to provide nutrition services under 3E as well. Section 1321.84 specifies that nutrition services include congregate, home delivered meals, nutrition education, nutrition counseling, and other nutrition services. Congregate meals are meals meeting the dietary guidelines for Americans and the dietary reference intakes as set forth in Section 339 of the Act, provided under Title III, Parts C1 by a qualified nutrition service provider to eligible individuals and consumed while congregating virtually or in person, except when provided to complement the congregating meal program through self-stapled pickup, carry-out, drive-through, or similar meals. And we often know them as the grab and go. As stated, this provision allows for a limited number of grab and go meals to be provided through the congregate meal program. In some instances, we will further discuss providing grab and go meals through the C1 funds later in this presentation. Please note that the state determines the nutritional requirements for congregate and home delivered meals, which we will define next. These requirements must comply with the most recent dietary guidelines for Americans, or to keep it short, DGAs, and meet 33 1/3% of the recommended dietary reference intakes, or to keep it short, DRIs. And so the dietary DRIs and DGAs are identified for those 60 and older, and the dietary guidelines translates into the nutrition requirements from the DRIs into food and beverage recommendations. These recommendations are broken down by age group to allow meal planning to meet that specific population's nutritional needs. Section 1321.84 also specifies that home delivered meals are meals that meet the dietary guidelines for Americans, and again, the DRIs, as set forth in Section 339 of the Act provided under Title III, Part C2, by a qualified nutrition service provider to eligible individuals and consumed at their residence or otherwise outside of a congregate setting, as organized by the service provider under the Act. Meals can be provided via home delivered. They could be provided by pickup, carry-out, drive-through, or similar meals. Eligibility for home delivered meals is not limited to those that are homebound. Eligibility criteria for home delivered meals may include considerations for individuals' ability to leave the home unassisted, ability to shop for and prepare nutritious meals, degree of disability, or other relevant factors pertaining to the needs for their services, including social and economic needs. Home delivered meal service providers may encourage meal participants to attend congregate meal sites and other health and wellness activities as feasible based on a person-centered approach and local service availability. So now I'm going to turn it over for a bigger, deeper dive of our nutrition services part of the Older Americans Act. And so I'm so happy to introduce you and welcome Patty Kean, our national nutritionist.
Thank you, Carrie, for that introduction. So Section 1321.87 continues on to specify that nutrition education is information provided under Title III, Part C1 or 2, which provides individuals with the knowledge and skills to make healthy food and beverage choices. Congregate and home delivered nutrition services shall provide nutrition education as appropriate based on the needs of meal participants. Nutrition counseling is a service provided under Title III, Part C1 or 2, which must align with the Academy of Nutrition and Dietetics. Congregate and home delivered nutrition services shall provide nutrition counseling as appropriate based on the needs of a meal participant the availability of resources, and the expertise of a registered dietitian nutritionist. Additionally, Section 1321.87 specifies that other nutrition services include additional services provided under Title III, Part C1 or C2 that may be provided to meet nutritional needs or preferences of eligible participants, such as weighted utensils, supplemental foods, oral nutrition supplements, or groceries. So while the rule clarifies these other nutrition services may be provided, they should not duplicate services available through other federal funding. So you should work with partners to avoid duplication and focus on a person-centered approach. For example, if the State Unit on Aging, the AAA, or the local service provider is concerned that based on intake information, nutrition counseling, an ADRC referral, etc., that a nutrition services participant needs a second meal, the responsible entity may want to refer to other programs to ensure that this individual has access to programs that are funded, for example, by USDA, such as the Supplemental Nutrition Assistance Program, or SNAP, the Commodity Supplemental Food Program, the Emergency Food Assistance Program, or TFAP, or the Senior Farmers Market Nutrition Program, and local food pantries. We know that other nutrition services may not always be available or be available with Older Americans Act funding. So given funding limitations, we need to prioritize services and other potential constraints. We encourage you to reach out to your SUA or your AAA. If you're at an SUA, please reach out to ACL if you're interested in offering other nutrition services. SUA shall also establish policies and procedures that define a nutrition project and include how a nutrition project will provide meals and nutrition services 5 or more days per week in accordance with the Act. The definition of nutrition project established by the state agency must consider the availability of resources and the community's need for nutrition services as described in the state and area plans. 1321.87 also addresses the Nutrition Services Incentive Program, often referred to as NSIP. The Nutrition Services Incentive Program allocation amounts are based on the number of meals that are reported by the state agency that meet the following requirements. Meals are served to an individual who is eligible to receive services under the Act. Meals are served to an individual who has not been means tested to receive the meal. Meals are served to an individual who has been given the opportunity to provide a voluntary contribution. Meals meet the other requirements of the Act, including meeting the dietary guidelines for Americans and dietary reference intakes. Meals are served by an agency that has a grant or a contract with a state or area agency. It also includes that Nutrition Services Incentive Program funds may only be used to purchase domestically produced foods used in an eligible meal. Now, let's talk about the provisions that allow Title III-C funding for shelf-stable, carry-out, drive-through, or similar meals, often referred to as grab-and-go meals. So per 45 CFR 1321.87 A1I, if included as part of an approved state plan, as set forth in section 1321.27 or state plan amendment as set forth in 1321.31A, and area plan or plan amendment as set forth in section 1321.65, and to complement the congregate meals program, shelf-stable, pickup, carry-out, drive-through, or similar meals may be provided under Title III, Part C1. We will provide more detail in upcoming slides. No state plan amendment is needed to provide grab-and-go meals with Older Americans Act Title III C2 funding, so the home delivered meals funding. This use of 3C2 funding is permitted under 45 CFR 1321.87 A2. Additionally, rather than go through the state amendment plan process, the state plan amendment process, the SUA could exercise its transfer authority to transfer up to the maximum amount allowable from 3C1 to 3C2, and then use the transferred funds, which would then be 3C2 funds, for grab-and-go meals. An area plan amendment may still be required depending on state policies and procedures. So see 45 CFR 1321.65 regarding area plans and area plan amendments. Note also the limitations on the use of 3C1 funds for grab-and-go meals. So see 45 CFR 1321.87 A1 2 and A1-3. So per 2, such meals shall not exceed 25% of the funds expended by the state agency under Title III, Part C1, to be calculated based on the amount of Title III, Part C1 funds available after all transfers as set forth in 1321.9 C23 are completed. Not exceed 25% of the funds expended by any area agency on aging under Title III, Part C1, to be calculated based on the amount of Title III, Part C1 funds available after all transfers as set forth in Section 1321.9 C23 are completed. Such meals only may be provided to complement the congregate meal program in the following circumstances. A, during disaster or emergency situations affecting the provision of nutrition services to older individuals who have an occasional need for such a meal, and or to older individuals who have a regular need for such a meal based on an individualized assessment when targeting services to those in greatest economic need and greatest social need. If the SUA wants to allow the use of 3C1 funds for grab-and-go meals, the state plan or state plan amendment must include the following information. Evidence using participation projections based on existing data that provision of such meals will enhance and not diminish the congregate meal program, and a commitment to monitor the impact on congregate meals program participation. A description of how the provision of such meals will be targeted to reach those populations identified as in greatest economic need and greatest social need. A description of the eligibility criteria for service provision. Evidence of consultation with area agencies on aging, nutrition, and other direct service providers, other interested parties, and the general public regarding the provision of such meals, and a description of how provision of such meals will be coordinated with area agencies on aging, nutrition, and other direct service providers, and other interested parties. Per 45 CFR 1321.31A, this type of state plan amendment would require the Assistant Secretary for Aging's prior approval. The requirements for submitting the state plan or plan amendment can be found in 45 CFR 1321.33. Each state plan or plan amendment which requires approval of the Assistant Secretary for Aging as set forth at Section 1321.31A shall be signed by the governor or the governor's designee and submitted to the Assistant Secretary for Aging to be considered for approval at least 90 calendar days before the proposed effective date of the plan or plan amendment, according to guidance as set forth by the Assistant Secretary for Aging, except in the case of a waiver provided by the Assistant Secretary for Aging. In advance of the submission to the Assistant Secretary for Aging to be considered for approval, The state agency shall submit a draft of the plan or amendment to the appropriate ACL regional office at least 120 calendar days before the proposed effective date of the plan or plan amendment, except in the case of a waiver request or as otherwise provided in guidance as set forth by the Assistant Secretary for Aging. The state agency shall work with the ACL regional office in reviewing the plan or plan amendment for compliance. 45 CFR 1321.65, which addresses area plans and area plan amendments, also applies to the use of 3C1 funds for grab-and-go meals. Under that section, the SUA must have policies and procedures regarding area plan requirements that include the following. See 45 CFR 1321.65B10. So 10, if the area agency requests to allow Title III C1 funds to be used as set forth in section 1321.87 A1 through 3, it must provide the following information to the state agency. So evidence using participation projections based on existing data that provision of such meals will enhance and not diminish the congregate meals program, and a commitment to monitor impact on congregate meals program participation. Description of how provision of such meals will be targeted to reach those populations identified as in greatest economic need and greatest social need. Description of the eligibility criteria for service provision. Evidence of consultation with nutrition and other direct services providers, other interested parties, and the general public regarding the need for and provision of such meals, and a description of how provision of such meals will be coordinated with nutrition and other direct service providers and other interested parties. For this final portion of our presentation, I'm going to provide some closing remarks and cover some resources, as well as what to expect in the coming months. ACL is striving to provide robust training and technical assistance. We have a very thoughtful and organized plan, including roughly monthly webinars for the broad aging network that we continue to roll out over the next year. The rule covers a lot of program areas, so we are breaking the rule down into various topic areas to focus on training the network. Again, much of what is in the final rule is simply reaffirming and better organizing what is in statute, prior regulations, program instructions, and existing policies. We are working directly with our grantees to implement the rule as well. So this means that we will direct AAAs and service providers to work with their grantors, so such as the SUA or the AAA, regarding their questions, as the rule requires policies and procedures that the SUAs and the AAAs will be responsible for developing and implementing. Again, the compliance date is not until October 1st, 2025, so we have time to do this work, and we have a supportive correction action plan process if needed. So what's next? So coming soon, we will have a fact sheet on nutrition services under Title III. Later in October, there will be a webinar on contracts and commercial relationships, and registration for this webinar will be made available ahead of time and included in an ACL announcement, as well as on our acl.gov/OAA rule webpage. And we have additional planned upcoming Back to Basics webinar sessions on emergencies and disasters, conflicts of interest, the long-term care ombudsman, as well as others that will be announced at a later date. So please stay tuned. There is much more to come. This slide has a link to the final rule as published on February 14th of this year. We have a webpage dedicated to the final rule. So that's acl.gov/OAA rule, which currently includes webinar information. So the recording and slides of the last Back to Basics webinar on state and area plans and funding formulas, which was held on June 27th, are now posted there. We have fact sheets. There are currently 2 general fact sheets, a short 2-page handout, and then a longer expanded 6-page fact sheet to give an overview of the final rule. There's also a fiscal policies and procedures fact sheet and a Title III 6 coordination fact sheet. We plan to add to the site with additional fact sheets that are developed on other key topic areas. The site includes our ACL announcement and will include additional resources as they are available, such as the Title III select topic areas to review for SUA's document and the Older Americans Act Regulations 1988 to 2024 comparison chart. These 2 can be found under More Resources for Grantees. This webpage is where you will find information on upcoming webinars, recordings of webinars, and other updates related to the final rule. We invite you to visit the Nutrition and Aging Resource Center at acl.gov/senior-nutrition. So the Nutrition and Aging Resource Center builds the capacity of senior nutrition programs funded by the Older Americans Act to provide high-quality, person-centered services and to assist ACL and stakeholders with identifying opportunities to enhance program sustainability and resiliency. The Nutrition and Aging Resource Center, in collaboration with the Office of Nutrition and Health Promotion Programs, develops and publishes a number of resources. For example, currently, the website provides hundreds of resources that cover Older Americans Act basics, innovations in nutrition, instructional campus on aging nutrition known as ICANN, as well as a catalog of topics from business management, food insecurity and malnutrition, health and well-being, nutrition education and counseling, nutrition guidelines, social isolation, underserved communities, and so much more. A few specific resources we want to highlight related to the final rule are the NSIP FAQ, Frequently Asked Questions document, and the NSIP Domestically Produced Foods FAQ. Then other nutrition services. So again, these are around those materials or supports such as supplemental foods, weighted utensils, and other adaptive eating equipment, health and nutrition assessment and screening. So a great resource there for other nutrition services. The Older Americans Act Nutrition Services Basics webpage. So this is a page that includes resources just regarding the basic requirements of the Older Americans Act Senior Nutrition Program. And then an Emergencies and Disasters webpage. So this includes resources and frequently asked questions to help you during emergencies and disasters. This is just a small sample of what you can find today on the Nutrition and Aging Resource Center. And so we encourage you to venture around that website and find resources for your programs. We want to make sure you're aware we are not done after this webinar. We will continue to provide resources to help states, AAAs, and local service providers as you become compliant with the final rule. And as a little sneak peek, some upcoming resources that we're excited about include resources on the greatest economic need and greatest social need. The Nutrition and Aging Resource Center will release an ICANN module on this soon. We'll have an update to the voluntary contributions resource. And in the coming months, we will release the Congregate Nutrition Program Quality Review Toolkit, which is a set of quality-focused tools for local service providers to assess their Older Americans Act Title III C1 congregate programs and services, confirm compliance with Older Americans Act basic requirements, and identify higher level operations to expand, innovate, and promote their programs. We plan to develop a home-delivered meals quality review toolkit. However, the timeline for that is to be determined. So please visit the Nutrition and Aging Resource Center and visit often. On the landing page of the Nutrition and Aging Resource Center, you can scroll down and you will see a button to subscribe to their newsletter, the Nutrition and Aging newsletter. So signing up, that will ensure you don't miss out on the numerous resources that will be released in the coming year, as well as educational and grant opportunities. I want to thank you. We want to thank you for your interest in this webinar on nutrition services under Title III. We know we covered a lot of information, and we hope the 2024 Older Americans Act final rule helps make the requirements clear regarding planning and development of the state's aging network. Thank you for all you do for older adults and caregivers across America. And this concludes today's webinar.